I'm now with Mathew Cherian, the Managing Director of Global Health Limited. That's ASX ticker code GLH. Tell us about your experience here at the Microcap Conference.
Well, I think it's been illuminating. I tell you, everyone's got this huge opportunity to sort of morph quite significantly, isn't it, into a unicorn. So I think it's great. Well, great stories.
And your fantastic speech, your presentation, Global Health. Tell us about your organisation.
Well, we focus on supporting patients living with lifelong conditions, what's often called chronic disease. A lot of it is genetic, but a hell of a lot more is behavioural. You know, we drink too much, we don't exercise enough, we eat the wrong foods, we have high blood pressure, we get anxious about our image, or, you know, so, and 60% of Australians have chronic disease. You know, that's huge. That's about, what, 15 million or something, yeah? And of that, chronic diseases, mental health is probably 2 of the top 5. So that's depression and anxiety, and that's the area that we're very strong in, supporting, you know, Headspace and community health centres and organisations that support people living with a mental health condition or a chronic condition, regardless of where the delivery is. So if you've got, you know, community health encounter, but if it becomes serious, you go into a hospital, and then you might have a rehab at home. And so our application supports delivery of those services regardless of the location. And a key part of it is the fact that we also have a consumer application, because we realize that people with chronic diseases really have a care plan that involves themselves changing their behavior. Typically, eat less and run more, right?
Yes.
But eat less sugar, whatever. So that's a space that's sadly growing.
And where to for next year for Global Health?
Well, next year we're going to focus on the consumer side of things. So we've got the provider applications and the what's called digital front door to engage with your patients or your clients. And next year we want to start empowering patients to be able to monitor their behavior and measurements and maybe escalate it back to their care team to say, you know, Matthew's hasn't put in his weight for the week or hasn't put in his assessment, you know, on a scale of 1 to 10, how do you feel, all that sort of stuff. So we want to be able to get that connection happening better between consumers and their clinicians. And we want to be able to give them content so they know how to modify their behaviour.
Fantastic. Well, all the very best with that. We look forward to hearing more from you. Mathew Cherian, this is an exciting news story.
Yeah.
And congratulations on what you've achieved today. We look forward to seeing the customer experience next year.
Thank you, Alex.
Mathew Cherian, Global Health, and that's ASX ticker code GLH. Thank you so much for watching.